Have you had cosmetic acupuncture before?
Never.
Okay, great.
My first time.
Oh, that's exciting.
Yeah, exciting.
Any areas you really want to focus on? Or you just want to experience?
どうしますか?
Lift up.
Lifting it?
Okay. All right, perfect.
Yeah, I grind my teeth while I'm sleeping.
Okay. Do you grind during the day too, or
no,
just at night?
Sleep while sleeping.
So when you wake up, you realize it's very tight in here? Okay.
Also,
All right.
from here,
Mm-hmm.
it gets
Swollen.
swollen.
Yeah. Okay. All right. We can definitely work on that. Let me do your pulse really quickly. And one of you is also an acupuncturist, right? As well?
Yeah.
Oh, nice. Are you in Japan or here in the States?
Japan.
And can I see your tongue? Underneath? Okay, thank you. If you want to take off your shoes, or you can leave them on and just lie down, face up. So generally with the cosmetic acupuncture, first of all, I'll only use Seirin needles because, well, I mean, you all know the quality is there. Patients get really nervous about any, bruising or any pain, particularly on the face. It's very sensitive. So, I'm maybe more comfortable using other needles for distal points, but I always use Seirin for the face. It's the safest. Patients are very comfortable when you use those needles. So, I generally like to use the reds. Particularly, you can kind of start with greens on some of the areas, but with a lot of patients, as you do many cosmetic treatments, their skin will improve and it will be more difficult to needle because you'll increase the collagen production. So you'll have to use a little bit thicker than the green as you progress, and that's a good sign because the patient's skin is getting better and it's not having the same drag to it. And then for distal points, I love using the blues because I do incorporate E-stim, the electrical stimulation, for some distal points because you can set a frequency that will be really good for the blood vessels, for the skin, and boost any underlying deficiencies that the patient has going on. And so need a little bit thicker needle for the E-stim. So. Let me know if anything's uncomfortable, okay? I can always adjust the needles, and I don't generally use alcohol on the face because it can actually stain the skin. But if a patient requests it, like if you would like alcohol, I'm happy to use it. But usually patients do not want that because they leave out of here and go back to work, go back to their day.
A little bit heavy.
Heavy there? Okay. Uncomfortable? Okay. Is that better? And you have makeup on right now, right?
A
A little bit? Okay. So we will work around that. No worries.
What is a particular name of point?
So this is close to do 24, but with the cosmetic acupuncture, we kind of frame the face for the lifting. So some of the points are not going to fall directly on the channels. No pain? Good. That's what we want. But that also matters not just with my technique, but the needles as well. So you can thread these. The reds work well enough to thread. So she doesn't have wrinkles. She has a beautiful face. But for myself, I have forehead wrinkles, so I use a lot of needles threaded under, and that helps lift the wrinkle and increase the collagen in that area. She has a nice youthful face, so we don't have to thread anything.
People often come for the lifting.
Mm-hmm.
My skin is also breaking out.
Mm-hmm.
Some people come to treat breaking out.
Yes.
Also.
And usually with the breakouts or with any type of thing like that, we'll also do herbs. So it would be a little bit of a longer consultation. We're doing a nice intro today. But yeah, if you were coming for the breakouts, we'd absolutely do a custom herbal formula to help with that. And usually when patients come for cosmetic, I recommend planning for at least 10 treatments for them to get more lasting results. Because you'll feel good coming out of here and your skin will look good, but when patients have real issues, you know, to work on as far as wrinkles, it takes a few treatments to really start seeing results. I usually have patients come twice a week for 5 weeks, so 10 treatments. Yeah, and then also depends a little bit on the patient. Like I said, her skin is so beautiful. Like, you'd be feeling great probably after 5, so you don't need the full. And I'll use 12, the greens sometimes, particularly on older patients with very, very thin skin. Cosmetic, I would generally use these, the reds. But yeah, for an older patient or someone with very thin skin or very sensitive skin, you can sometimes start with the greens. But as the skin gets healthier and stronger, you have to use reds because the greens are too thin, they won't thread very well. And with the cosmetic, we think about gravity. So it's like fighting gravity, pushing everything up. Was that the most sensitive one out of all of them, the ear? So the face isn't bad, right?
Isn't bad.
Not bad? Yeah. Okay.
Good, better.
Yeah.
Easily open.
Okay. Yeah. So yeah, all the needles get angled up because as we age, things go down. So we want to direct everything nice and up. I'm gonna do 2 more and then we'll be done. Last 2. Do you feel any tingling on the face or like movement of anything? All those feel okay? All right, now I'm gonna hook up the e-stim to the ones on your hands, okay? But I don't want it to feel heavy. And I don't want it to feel really strong. I want it to feel very mild. All of the research with e-stim shows that it can even work at a subsensory level or a level below where you're feeling it. So you still get benefit. It's kind of a myth that it has to be very intense for patients to get benefit, which I think you guys probably understand because you appreciate the painless approach with Seirin. E-stim doesn't have to be painful either. Is that better? Okay, good. Yeah, patient comfort is key. So, all right.
Explain again why you use e-stim.
So the e-stim, the research shows that different frequencies can affect different levels of the body. So the skin, the organs, the blood vessels. So a lot of times with cosmetic acupuncture, we want to definitely work on the skin, so we use a frequency for that, but we also want to work on circulation in general. And this point is the command point of the face. Also, large intestine is going to go up to this area. So we're going to be feeding this channel with electrons, which is going to bring oxygen to that area, help with healing, and help with the overall treatment. You feel it? Okay. Put it down a little? Okay. How's that? Better? Okay. Like I said, it doesn't have to be strong to be effective. Even if it's at a very low level, the patient still gets the benefit of the electrons and the increased oxygen to that area. And then we would retain for about 25 minutes. So yeah, if this were other needles, you'd have so much blood. There wouldn't just be like a little bit of redness. But the Seirins are so nice and good quality. So yeah, maybe 2 out of her 20 points had a little bit of blood. If we used a different type of needle, like a competitor's needle, most of them would have bled. Because there's so many little vessels on the face, it's very hard to needle and not have that response. I'm gonna put a little arnica.
My skin is a little sensitive.
Right. And even for you having sensitive skin, to not have, pain and a
もともとちょっ
reaction
と敏感
is...
肌なので、
Okay, now,
サーキュレーションというか結構広げて全部箇所に貼るっていう。
and you said you have jaw stuff, so we can give you a little help with that as well, just for your jaw. I usually would have patients come in with no makeup whatsoever, and then we would do basically arnica on the entire face, and that would help as well. I'll do a little rolling for you, okay? It's like all Seirin and Lhasa products today. And I usually will have patients do this for themselves at home as well.
これだと家だと
cold.
It's cooling, yeah. And usually people will use either jade or rose quartz. And, jade can be a little bit more cooling, but it's really a personal preference. You can use both and have very similar results. How do you feel?
I'm good.
You're good?
Very warm.
Yeah, now that the circulation, yeah. That's why the jade is nice. It's a little cooling afterwards, because with all of those needles, even though they're so small, you've increased all the circulation in the face. So that's a good thing, but we'll want to keep that moving and relieve the stagnation and the heat. So, all right, you can sit up if you'd like. I will be right back with that.
なんか違いますよね。
ちょっとすごい違う。
疲れが取れたかも。ちょっと
確か
ね、すっごい目が開けやすい。全然痛くなかったし、ここちょっと重い感じがします。すごい。Yeah. Yes, it does.
No, you're welcome.
Before getting treatment, I was really tired.
No,
Tired.
you've brightened
Yeah,
up.
now
Yeah.
You really changed.
Good. Good.
You know it.
Yeah, and it would, with continued treatment, you would see even more of a difference. Like one treatment is kind of like a facial. It feels good and you're, bright and you've got, good collagen stimulation, but with continued treatment, you would see even more of a difference. But you don't have a lot of problem areas, so you wouldn't need to keep coming for treatment. For people who have, like wrinkles like I do, I would need a few more treatments. But you get results right away, so that's wonderful.